Sometimes I think there wasn't a grand plan for all of this, but leadership opportunities come at the opportune, sometimes inopportune moments, and you have to decide. But all of you have to be leaders at some sort of level. So I'm going to talk about taking leadership to the next level. Again, you don't need a title to be a leader. To get where we need to go, you need to go within your department, within emergency medicine, within medicine. We all need to lead. And that's sort of one of the basic tenets that I want to get across. Well, what do your employers want? Silence. Results. Okay, so they want you to see patients. They want you to drive productivity. But if they want listening and oral communication skills. They want the adaptability and creative responses to setback and obstacles. When you go, for those of you who are in leadership positions, you go and talk with your CEO or whoever your supervisor is, if it's always about complaints, things not working out right, that's not leadership. You've got to sometimes be able to have that resiliency and look at creative responses to setback and obstacles. You have to present solutions sometimes rather than just constant complaints. Personal management, not personnel, but personal management. And we'll talk about that in 1 second. And group and interpersonal effectiveness. That's what real leaders and what employers want in you leading that emergency medicine group. This is what they're looking for. Yes, if you do these things, results will come. Sometimes if you get results, that doesn't mean you followed this, and rarely are those results sustainable. So you have to have effectiveness in the organization. You have to develop that. And part of that, I'm sure most of you have heard about emotional intelligence. There are courses out there. Developing Emotional Intelligence is a book by Daniel Goleman that I would recommend. If you haven't read that, you can also get the 20-minute YouTube refresher on YouTube if you Google that. But it's basically the capacity to recognize your feelings. Is my clock good? I'm like already negative. Did I already go past my time? No. Wow, I thought I just started. And then it's motivating yourselves, managing your emotions. That's critical. You need to step back. Being proactive is the first step in Covey's 7 Habits of Highly Effective People, but they call it responsibility. So you have an action and your response, but you've got to have the ability to sometimes taper that response. And then again, managing feelings so that they are expressed appropriately and effectively, enabling people to work together smoothly towards common goals. That's what emotional intelligence is. And sometimes you have to check that. Every shift you go in, you go, I've got to practice good here. Nothing's going to get me upset today. I'm going to provide great patient care. Or going into a meeting where you know it's going to be difficult. You've got to manage your feelings. So leadership. Again, if you read Covey's books, he's got the 7 habits, then he's got the 8th habit, and which is really articulating, rousing enthusiasm for a shared vision and mission. It's called helping you find your voice and find other voice in others. So step forward as a leader as needed, regardless of your position, and guide the performance of others while holding them accountable. That's the real key. Whether I've been a chair, medical director, executive vice president, a senior vice president, dean, is guiding performance, helping to provide the resources necessary for that individual or group to succeed, but then holding them accountable. So that often meant writing down goals, writing down performance evaluations. Let me see. And this is the 8th habit. Leadership is communicating to people their worth and potential so clearly that they come to see that in themselves. And that's how you manage people or lead people. So you've got choices here on the x-axis. The y-axis is what your employees will be feeling. If you manage by anger, these people are going to rebel or quit. And if you manage by fear, they may have malicious obedience, which means they will do things, but every chance they get to stab you in the back, they'll do that. If you only lead by rewarding, you will get willing compliance, but they won't feel that creative excitement or meaning in their work. And really those last three are management. Leading is helping them find a duty in their work, that they love their work, or that there's meaning in their work. And part of this, I think, leads into that physician burnout discussion, which you had yesterday and we talked earlier in my first talk, is you want people to find meaning in their work. Yes, there are obstacles, but how do we come together leading to reduce those obstacles so that we can find love or meaning in our work? That is the true essence of what leadership really is. The future viability of our organization will depend on the ability to deliver service excellence. This is from the Mayo Clinic. And importantly, a commitment to excellence will not manifest itself without leadership, support, and examples set by physicians. And I think that should be true of every hospital. Whether every hospital truly realizes that or not, physicians need to be engaged. They need to be engaged in leadership. They need to be engaging to helping improve the workforce, which is often reducing those restraining forces, and having people find meaning in their work. So again, why do CEOs consider the emergency department important? I mean, it's now about between 70 and 80% of all hospital admissions throughout the country now come through the emergency department. It may be less in some, transplant centers, things like that, but the majority, particularly out in the community now, the majority come through your emergency department. It has now become the front door. So we have to have effective leadership because we are the people you first meet when they come to the hospital. So what do we want from ours? We want quality care for our patients. We want efficiency of our practice. We don't want to keep coming up to roadblocks, those restraining forces. Responsive to our issues by the hospital. If we have a problem that we can articulate that, hopefully have some solutions, and we can work on those solutions. Appreciation for what we do. Most of the issues in the emergency department are system issues. If your hospital doesn't realize that, you need some work to do that. But it should be a team. It is a system-wide response. It's not, your length of stay, your LWATs left without treatment is an ED issue. It's really a system issue. In fact, 2 weeks ago, I did a presentation in front of the CEO, the board members, and one of our issues are LWATs and length of stay. And I said, we own maybe 20% of this issue. We've done a physician in triage now. We're working on our nursing call-offs. We're scripting patients. But here's my system issues. Lab is taking too long. My radiology turnaround is not great. I've got admission orders from consulting services taking way too long. And I measure each of that. Sometimes environmental services are not cleaning the beds. They need to adjust. There are a lot of things that are system issues that you need to get them to think about in terms of system issues. Again, we want a balanced life, right? Work to live, and you want a good income. What do CEOs want? They want as many patients as possible, high patient satisfaction, efficient throughput, no diversion, no left without being seen, no patient complaints, no medical staff complaints, and no premium labor usage. That's easy, right? But that's what they want. They will say, here are my expectations, get it done, but what's the problem? They have no idea how to get it done. Absolutely no idea how to get that done. And they depend on you. So leadership skills are going to be important. Sometimes it's even just getting them to understand that there is this system issue. It is not just an ED issue. I've spent most of my career, especially early in my career, trying to get that across. but it is a system issue. And again, most situations you're in charge of the emergency department, but not the rest of the department. That's why you need to make this a systems issue that we all are working on. It's not just an ED issue. It affects your elective surgery schedule. It affects what time you discharge your patients in the morning, opens beds for me, when those are getting cleaned. It has to be a whole system issue. So you've got to work to try to get, yes, you will be held accountable, but you've got to work within your system. You've got to use all your leadership skills in order to engage the people you need to engage in the system to help you with that. So, the real question is, how do you do it? What are some actions that can help become a better leader in the hospital? Well, again, a staff leader defines a vision and gets everybody on board. That's what a leader is. You've got to define a mission of or vision of what you want in your department. Help create a great practice environment and fix the system. That's more of a managerial responsibility, but sometimes you have to move between the two, or you've got to bring on a manager a medical director who's going to get that done. Engage your staff and providers, create the team, that's a good team player, and ensure consistent clinical quality and service excellence, be a healer. And sometimes you have various roles in your department. Rarely can you be all of these. I mean, you can have characteristics of this, but it depends on what you want to do within your department. You have to, again, define that role. And again, leaders establish a clear vision. What do you want to be known for? You have to ask that question. So when I came in, to SUMA, I said, we're going to talk about this next, wildly important goals. One was to establish the clinical respect and accountability within the health system. Second was to reestablish emergency medicine residency. And third was to improve the public perception of SUMA emergency medicine. So those were three big goals, and that was the vision that I wanted to create. And so that leads me into how to take your leadership to the next level. What I just talked about are basic leadership tenets. Anybody heard of the 4 disciplines of execution? Recommend that you think about getting this book, because I'm going to talk. We actually use this practice now within the Midwest Vice President Group at USACS, and we lead our meeting every week using the principles of 4DX, which is Chris McChesney and Sean Covey are the authors of this. But 4 disciplines of executions looks at really different things. You want to focus on the wildly important, but there's a difference between a lag and a lead measure. So when I talked about my wildly important goal was to reestablish clinical respect and accountability. So I said, I've got my LWATs, my left without treatment, and my length of stay. Those are big measures. Are those lag or lead measures, though? If I get my LWAT number at 2.8%, that's already been done. That's not really a lead measure. That's a lag measure. It means by the time I get that number, everything's been done, right? But we spend our whole career looking at lag measures, right? LWAT, length of stay, patient experience number, HCAHPS. Those are lag measures. But we spend our whole career looking at those. But we should be focusing on lead measures. So left without treatment, what would be a good lead measure? Time to doc, all right? And that's what we picked, time to physician. We had to, because we figured if we could lower the time to physician, that the left without treatment would decrease, right? That's something I can actually measure. That's a lead measure. So we actually ended up putting a physician in triage and got that time to doc down, which did improve our left without treatment. So 4DX focuses on lead measures versus lag. And just remember, we spend most of our career looking at lag measures when we should be doing lead measures. Really, it's the result of what you're trying to achieve. They lag because the data and the result has already happened. They're always lagging. Lead measures foretell the result. They are predictive and influenceable. So we should be focusing on lead measures. So length of stay was another big one for us. Again, my length of stay for whether it's admitted or discharge, I'll go admitted patients because we were creeping over 6 hours. But that's a lag measure. What are my lead measures? Lab time, lab turnaround time, x-ray turnaround time, bed turnaround time, admission orders. And I measured every one of those, and we're looking at trying to improve that. Point of care testing, trying to write holding orders, because those are the lead measures that are influencing my lag measures. So we really started to rework how we thought about the problems. And the 4DX also talks about you have to develop the wildly important goals, which I mentioned my 3 wildly important goals. But every day I've got this whirlwind. So yes, I have to act on my wildly important goals, knowing that 80+% of my time is doing with the whirlwind. You get calls from the nurse manager, you get a patient complaint, there are a lot of things that you have to do. I have to develop a lecture to come here. So that's the whirlwind that takes me away from the WIG, which is your wildly important goal, but you need to think about that. So discipline 1 of the 4 disciplines, there will always be more good ideas than there's capacity to execute, and that we focus on a small number of wildly important goals. And so I set up 3. And if you set up too many, and this slide shows here, if you set up 11 to 20, you will probably achieve 0 of those because you're going to be out in the whirlwind here and not focusing. 4 to 10, you might get 1 to 2. If you set up 2 to 3, you will accomplish 2 to 3. And so every week we have a meeting with our vice presidents. We sit down and we go over our wildly important goals. And again, 15 to 20% is really your time is spent on achieving that, and knowing that the day-to-day job, all the stuff, your shifts and dealing with personnel issues take up the bulk of your time, but you've got to keep focus on your wildly important goal. So again, we had no more, I set up 3 wildly important goals for our team. The battles have to win the war. You can have a veto over, as a leader, but you can veto an idea, wildly important goal, but you're not going to dictate what their goals are. And then setting up a goal, you have to have a gap from X to Y by when. So, establishing the reputation, the clinical reputation, I wanted to reduce length of, or left without treatment from 3.5 to 1.5 by July 2018. That was my goal. So you have to set up those. And basically you set up your WIG, but then you work from right to left here. What are your influences? What are going to be your lead measures? So it's time to dock. How do you set, what are the goals? What are you going to do to decrease that door to dock time, which will then measure my left without treatment, which will actually help me with my WIG in reestablishing clinical respect. So, and you can go through this exercise for every wildly important goal, but make sure you understand the difference between a lead and a lag measure. Discipline 2, act on the lead measures. They act like a fulcrum. If you can attack those lead measures, your lag measure will improve. You've got to divide down your lag measure into lead measures that you have influence over. The third is keep a compelling scoreboard, because you know what? People play differently when they keep score. And so we keep score now on a lot of different things, and we present it to our people. A scoreboard should be simple, highly visible, has the right lead and lag measures, and tells you immediately if you are winning or losing. And again, scoreboards built by the team can be disturbing to leaders because sometimes the lines aren't all flowing nicely. But we haven't done such visible ones. But here are things, and we routinely publish this. This was our door to dock seen by provider. Now, I even have lines when they close beds. The first rise of that purple line was they closed beds over at one of our hospital, because they didn't need as many hospital beds. The second peak is they closed hospital beds at my facility. And then where it dove down is when we started physician triage, which was at the end of August 2017. So we're showing how the hospital changes, our system affects our ability. But then when we implemented a program to physician and triage, we are decreasing our door to provider. And then we compare ourselves to other hospitals in our region, which are the 8 in the sort of the central Ohio area. And then we did our left without treatment. And again, we put, these are when the beds have been closed, and this is when we started triage and physician and triage. You can see our left without treatment went way down, and that corresponded also to our other lead measure, which was time to doc. So time to doc was a lead measure, left without treatment was the lag measure. But again, we highlight this, and then we highlight where we are. We're not number 1. We're third in this. This is the ED compare, CMS compare data that we can get, and we give this and print this out. And I do talks to my group every month, and I show them this data, how we're making improvement in order to try to get buy-in. So the fourth discipline is create a cadence of accountability. So every week, the vice presidents meet and we go, what are the 1 to 3 most important things I can do this week to impact my lead measure? So we start our meeting out, and every vice president starts your last week's WIG commitment. So you said, and we do 2 types of wildly important goals. One is we have what's called a national promoter survey or score, which, how are your clinicians and how are your administrators, do they view your group as successful, a good group? It's called an NPS score. And then we also look at EBITDA, which is earnings before income tax depreciation. And so we have an NPS WIG and an EBITDA WIG, and we report on last week's commitment. Did we succeed with that? We update our scoreboard if we can. If we've got data, we will update our scoreboard, and then we make commitments for the next week. And this is what we do every week. So we're really well-defined or well-focused on the wildly important goal, knowing that I'm only going to be spending 15 to 20% because of the whirlwind out there, but we focus on this and we report this every week. The 5 vice presidents in the Midwest, we get together and we discuss last week's commitments, we review any update and scoreboard, and we make WIG commitments for the upcoming week. And we hold each other accountable because we're a team. We're all part of the same company. All of our success, our individual success in our hospital system is everyone's success. So we hold people accountable. So again, discipline 1, focus on the wildly important. Only have 1 to 2, wildly important goals per team, because the more you have, the less that you will actually succeed with. You have to say no to good ideas. There are more good ideas than you have the capacity to do. So, and you can't make everything a whirlwind goal, because whirlwind, you will get stuck in the whirlwind. We all get sucked into that whirlwind every day, but we lose focus of the WIG. Act on lead measures. It must be predictive and influenceable. Don't get fixated on the lag, because we all have lived in that lag world, but you've got to find the lead. And then keep a compelling scoreboard. Keep it simple, visible. Keep your people informed, especially if you're doing things well. It can tell if you're immediately winning or losing. And then create a cadence of accountability. We have a meeting every week where we go over last week's commitments, update our scoreboard, make new commitments. You don't tell someone what to do. You work on keeping this cadence so that the reports come and there's a cadence to it, and you start again. That way you can help each other with their goals because you understand their goals and you don't get sucked into the whirlwind. So again, we've been using this for the last year, and I think we've had some success in moving our Midwest division, and particularly with the SUMA. So genius, that power that dazzles mortal eyes, is off preservation or in disguise. So always be hard work, but I think you can work more efficiently, and you can certainly lead more efficiently. And with that, I've got a few minutes to take any questions.